Women of Reddit that knew something was wrong but doctors kept denying it. What was wrong? I have 2 reproductive systems, 2 uteruses, etc. I had the most painful periods. Every doctor was dismissive, prescribed extra-strength Tylenol and said, "Oh, sorry. Periods are just sometimes painful." It went on for literal years. One day I was lying naked on my mom's bathroom floor in so much pain. So she took me to the ER and basically staged a sit-in until they agreed to give me an MRI right then and there. Turns out my 1 uteruses was blocked, filling up with years of period blood that had nowhere to go, causing all kinds of internal damage and the self-implosion of 3 of my 4 ovaries. God bless my mom. When I was 25, both of my legs suddenly swelled up ridiculously and I was unable to walk more than maybe about 50 feet at a time without feeling like it was sit down or collapse. Before that, despite being overweight, I was in the best shape I'd been in for quite a while. I was a late college student in my final semester on a walking campus, and taking 2 physical education classes. My mother has a genetic blood clotting disorder. I told this to each of the 5 doctors I saw over the course of a month as I explained that I abruptly was barely able to function and my legs were 2 to 3 times the size they should be. All insisted I was just fat and lazy. The most that was done was a single X-ray while I had to listen to the X-ray technician tell me all about how I just needed to lose weight and he used to be big too, but once he lost weight he could do so much more. Finally, because my dance teacher also didn't believe me, I was told I performed the final dance routine for my required PE class or failed the semester and this didn't graduate. I stumbled through the routine and collapsed. The teacher wouldn't look me in the eye. She later gave me an A in the class, and the other students rushed to surround me and told me to go straight to another doctor and refused to leave until they figured this out. This time, I went back to my usual doctor's office but a nurse practitioner came in the room, and she was immediately infinitely kinder than anyone I'd seen before. I still remember how relieving it was when she said, "Something is obviously wrong, and we're going to get to the bottom of it." She was listing tests to run and said, "In the meantime, let's try some compression socks, but be careful because they will run a small risk of blood clots." And I said, "I shouldn't do that then. My mother has a genetic blood clotting disorder and the doctors here won't test me for it." Her face literally went completely white. I've never actually seen that happen before or since. She said, "What?" And I said, "I've brought it up several times in the last month, and I've been asking to be tested for years. Is it not in my file?" And she said, "No." And then she rushed for a heart rate monitor and had me walk across the room. My heart rate skyrocketed and she said, "Go straight to the ER. Do not pass go, do not collect $200. Tell them you have blood clots in your legs, and probably in your lungs at this point." It was a terrifying 6 or so hours, with a nurse sent to talk to me who'd had clots in her lung and survived, and people telling me I had a whole 60% survival rate. I was incredibly lucky and there were no clots in my lungs. I got a clotbuster shot and a new lifetime blood thinner, starting at a higher dose, and was able to leave the hospital that night. I was able to walk across the stage at graduation, and was mostly back to my previous stamina by fall. But if that had gone undiagnosed much longer I likely would not be here. This actually happened when I was 2 and my mom told me the story. I had a cold for like a week or 2. My mom kept taking me to the emergency because each day I was progressively getting sicker. Each doctor my mom took me to, they said it was just my asthma making it worse because I was recently diagnosed with that as well. My mom went through at least 5 doctors within 2 weeks. Finally, my mom refused to be told I just had a cold for the millionth time. She fought for me to get a scan of my chest because something just wasn't right with me. And they took a scan after hours of waiting. I had pneumonia. They said it was so advanced that if my mom hadn't brought me in when she did, I would have died. Shout out to moms that listen to their gut heart BTW. We sued my primary care doctor for malpractice and he's no longer in practice. It wasn't me but my daughter. It was Turner syndrome. I kept insisting something was wrong and her doctor said to me, "You're just upset you have a short daughter." 2 years later she was in the ER in full-blown DKA from diabetes. Her endocrinologist noticed Turner's right away. Turns out I was right. I had migraines for years where the pain was so bad I couldn't keep water down. It always got dismissed by everyone. 15 years later a doctor finally took me seriously. The sinus part of my brain was super inflamed. She gave me medicine for it and 6 months later, my migraines and other problems I have having related to it pretty much disappeared. Rheumatoid arthritis at the ripe old age of 11. Surprise. It wasn't growing pains. My back. I've had issues since forever and finally decided to bring it up with my doctor when I was 19 because I was always in pain. She said, "It's so modern for you young people to have a bad back." She didn't even get up from her chair to look or touch my back. I told her I've always had issues and she said she would contact the hospital to get X-rays. An entire year passed and I realized she probably forgot to send my request to the hospital. I went down there again and asked once again. She said, "You're mentally ill and imagining the pain." Once again not getting out of her chair or even wanting to take a look at my back. I raised my voice and demanded she do her job so I could get those X-rays. This time she sent the request. I got a letter with an appointment and went to have my back X-rayed. I'm born with a back that isn't straight. The day I got the results back, I went downtown and changed doctor. The woman behind the counter in charge of this asked what the problem was with this doctor because so many people came there to get away from her. First time at my new doctor, she asked to see my back. I lifted my shirt and she said it was clearly showing that it's rounding in my lower back. Edit. I only had this doctor 2 years. I swapped to her when I turned 18 since our family doctor was a man and I wanted a woman. I can't tell you why my parents never brought up my back pain with the family doctor since they were aware of my pain. Back then she was the only female doctor with openings for new patients so I got her. Luckily 2 years later there were others to choose from. I'm 42 now and still with the same place I changed to at 20. They always believe me no matter what is going on, and they always make sure to run proper tests, etc. Got the runaround from specialist to specialist for years about severe abdominal pain I was having. Finally found a doctor who listened and advocated for me and was willing to do exploratory surgery. Nothing would ever show up on imaging, which is pretty normal for things like endometriosis, which I showed many symptoms of but had been told several times by different doctors it was impossible for me to have. It was not endometriosis, but several organs were fused to each other and my abdominal wall with regular scar tissue for God only knows why. My best friend has endo. For the past several years she'd been in near constant pain, struggling with GI issues and horrible cramping. Her GP kept saying it was IBS, and as she slowly gained weight, because moving became painful, the GP changed to, "This is all weight related. Move more, eat less, and you'll feel better." Her gyno agreed. Her therapist said it was health anxiety. After seeing her in person last year, we live on different continents. It was so clear she was really unwell. A bunch of us started pushing her to get new doctors, doing whatever we could do to support her. She found a new gyno who referred her to a surgeon. She finally had exploratory surgery last month, and guess what? All her organs were fused together and to her abdominal walls and diaphragm. The endo specialist said it's one of the most severe cases of endo he's seen. She will have to have a second surgery in the next year because it was too much to remove all at once. I want to strangle her previous care team for gaslighting her for years. If they'd actually listened to her, this would have gone so differently. She might have preserved her fertility, kept her entire colon, not been cursed with breathing issues for the rest of her life. So much anger. She has a PhD and is a very clear, firm communicator, so I know she continuously advocated for herself, and it didn't matter. My uterus had twisted a full 360 degrees while I was 6.5 mo pregnant. I was bleeding to death internally while my baby died. For most of my teenage years, I experienced a bunch of symptoms that all pointed to hypothyroidism. I was in and out of the doctor frequently due to these symptoms and got frequent basic thyroid labs, but nothing was ever escalated since they always came back normal. This doctor at one point told me I was just depressed because I was fat. When I was 20, I got a new PCP and I ended up having metastatic thyroid cancer that had spread to my lungs. I was told my oncologist that I had been growing cancer for at least 7+ years at that point, so all of my teenage years. Still hard to accept, but I can't go back and change it. Had excruciating back pain that I kept seeking help for weeks. I knew in my gut something wasn't right. Kept getting told it was a pulled muscle and no big deal. Just do physical therapy. One drive told me there is no way it's a herniated disc. Another said it's basically in my head and to simply take Tylenol. It got worse and then I started feeling numbness in my legs. Went to and was treated like I was seeking pain meds even though I said I wasn't in pain but going numb. Was sent home and told to wait it out that it would go away. I didn't trust the docs and went to my mom's so I wouldn't be alone. Next day numbness spread up to my stomach. So on the way to again, different hospital, my heart revved up and we had to pull over and call an ambulance. Rushed to where so many tests, imaging were done. I did indeed have herniated discs but I ended up needing treatment ASAP for a neurological disorder that could have killed me, Guillain-Barré syndrome. It can cause back pain like what I had and rapidly cause paralysis. I needed immunoglobulin infusions for 5 days. I had my heart short circuit during treatment too, causing an additional health problem I'm still on meds for. If I had listened to the other doctors I believe I would have died alone in my apartment. You're fine, it's just the flu. It was fucking COVID. Back when COVID was still killing young, healthy people. It took a year for my heart to recover. I was young, 19, and pregnant, around 6 months along, and started having a lot of pain. Lots of swelling. My doc, who was an absolute boss, started having the nurses write stuff in my chart to keep an eye on, but when I asked about it would just tell me it's fine, nothing to worry about. Went on another month. Then he started having me go in for glucose tests almost every week. This includes 24-hour fasts, and supposedly my blood sugar was fine. I am not a diabetic, it isn't prevalent in my family, and I wasn't eating a high-sugar diet. This went on for almost a month and a half, where he would smile and tell me things are fine. Within that month and a half BTWN 7 to 8.5 months, I had blown up like an elephant and had fallen in the bath the morning of my baby shower and landed on my belly. Went to the hospital. Lucky for me, I thought, that my doc's office was about a mile down the street from the hospital. This was early and they hooked me up and called him and waited. And waited, and waited, and he never showed. After about 6 hours of sitting there with nothing from my doc, the resident saw me and told me I had developed Braxton Hicks, and that they were sending me home BC otherwise we were okay. The nurse came in, and told me they called my doc numerous times and left VMs but that he was barred from the hospital BC. He had been sued by many of his patients from fraudulent and false record keeping. So that was fun. Then I go in for my first appoint at 8 months for my weeklies. BC I was high risk even though he refused to tell me why. And he tells me I am not doing so well and wants another blood glucose test. I got mad and demanded to know why, wouldn't say, just precaution. So I did it. Went back at 8.5 months, and he looked me dead in the eye with a smile. He had a creep smile always. And said, well, let's get you to the hospital today BC. If you don't get that baby out within the next couple of days you are going to die. Yup, verbatim. It's been 22 years and I won't ever forget it. He then admitted that I had gone into toxemia, preeclampsia and my body was trying to reject the baby so he wanted to induce me that day. It's already been a long story, believe me. This is still the short version. But I went into the hospital that night. Induced. Had emergency C-section BC. They gave me meds that wound up inducing a heart attack. I was hugely pregnant and had to have the heart attack stopped. Lost too much blood and had a huge transfusion. And then had my left lung fill up with fluid and collapse entirely so was again rushed to the OR to have it drained and reinflated. Oh, and I was clinically dead for a few minutes and revived. All of these before giving birth that same night between the hours of 10 p.m. and midnight. I was busy. All of it the doc's fault. Once all of that was over and I had finally had my kid removed from my body, I was taken to ICU for 3 days where I had rehab for my lungs, and it was one of the most painful things I have ever experienced. Yes, long, but this is actually the much shortened version of this, and all of this due to my doc denying that something was wrong for months. I was having horrible pain with penetrative sex. Felt like I was being ripped open. I did my own research and tried so many things with my ex. Foreplay for 30 to 60 minutes, toys, lube, drinking, and finally went to my GYN, a male doctor who told me, "You're young, don't worry about sex." But I told him, I'm 20, I should be able to have sex with my boyfriend, we're in a committed relationship. So he finally agreed to do a biopsy, and he literally cut off a piece of my labia and stitched it without numbing me, told me I have dermatitis and told me to see a dermatologist. The dermatologist admittedly took me seriously but wasn't convinced it was an allergy, but he did all sorts of testing and gave me recommendations that made sense but didn't help. It wasn't until a decade later that I went to a special clinic with a nurse practitioner that they diagnosed me within 5 minutes, tested for confirmation, told me how to fix it and had me talk to a therapist because of all the negative associations I had with sex. What was it? 12-pound fibroid. I kept saying there was something in there but kept being told I just had bad periods. I was vomiting every single day for months by the time I went to the doctor. I was told it was acid reflux, GERD. I told them I've struggled with that since age 16. I was 22 at the time, and it never made me vomit especially that badly. Then continues months of being told it was just anxiety or that I was addicted to marijuana, and I was accused of lying to my doctor about how much I was truly smoking. It turned out to be gastroparesis, aka my stomach was, still is, paralyzed due to vagus nerve damage. I wasn't diagnosed until almost a year after my initial appointment with the doctor and was severely malnourished. In my late 20s I started experiencing some weird symptoms like frequent UTIs and yeast infections. It was an annoyance, but the doctors I saw didn't think anything untoward was taking place. Then in my 30s the fatigue and muscle weakness set in. It got to the point where I'd sleep for 12+ hours and still feel completely unrefreshed when I woke up. I had to drag my body out of bed every morning and would be falling asleep in my chair during work by midday. I knew something was very wrong. My mother had a history of hypothyroidism, so I figured it might be a thyroid thing. During this period I saw 7 separate specialists, including GPs, gynos, endocrinologists, nurse practitioners, all who took a glance at me and said, "You're young and healthy, make sure you're taking your vitamins," and sent me on my way without any substantial testing. It wasn't until my mid-30s that I finally dug my heels in and told my new GP, "Something is very wrong. Please run a full blood panel, whatever you can to figure out what this is." She agreed without any hesitation, so grateful for her. She called the day after my tests, which I knew wasn't a good sign. As it turned out, I had LADA, adult-onset type 1 diabetes, confirmed by a $40 blood test that no prior specialist had bothered to run. My pancreas had been progressively sputtering out over all those years, and I was now at the point of crisis, with an A1C of 10.6 and on the verge of DKA. The next day I was on a table having insulin shot into me and several bags of saline pumped into my veins. I'm doing somewhat better now, though I still struggle with fatigue. I wonder how much unnecessary damage was done to my body during those years when my concerns were repeatedly brushed off. Always listen to your body. No one else knows it better than you. My son, I knew something wasn't right. He stopped growing at age 11 and started losing weight. He would vomit liquids, took an hour to eat a sandwich, would have horrible, explosive poops. I didn't want to worry my son, so I always tried to talk to his pediatrician for a minute or two in private, or have the nurse take notes to pass to him. For 3 years, the stupid drive dismissed me and went even so far to suggest that I should see a drive because I was imagining things. Yeah, right, what 13-year-old boy weighs less than he did at 10? After searching the internet, mid-2000s when there wasn't as much information as there is now, I came up with Crohn's disease. I asked his pediatrician about it and he immediately told me that my son was too young to get it. Another appointment, and the pediatrician actually felt my son's gut and ordered an X-ray because the doctor felt a lump. My son was terribly constipated and that's why he couldn't eat, because there was no room for it to go. Dumb doctor supposedly spotted a small white spot on the X-ray and sent my son for a CT scan. The white spot was made up. The scan techs were all chatty and nice the first part of the scan, then they were all business and I knew something was up. The next day I get a phone call from the pediatrician. My son had Crohn's disease. Up until age 11 feet-ish when I noticed his growth, weight stop, my son was happy and was friends with everyone. After diagnosis at age 14, it took another 4 years to wind through different treatments and medications before he finally got on a biologic and went into remission. My son is super bright, loving, but now an extreme introvert with 0 friends. He was in pain for 7 years because the effin' pediatrician wouldn't do his job, and the other pediatricians in the clinic that I tried to get help from didn't want to step on his pediatrician, so they all just went along with him. From this whole ordeal I realized that 1. Moms know more than anyone gives us credit for, 2. Doctors don't know everything, and 3. We really need to advocate for ourselves, family members. Went to military docs for enlarged lymph nodes and was told, "You probably have an infection." Didn't bother to check that out or even so much as give me an antibiotic. 2.5 years later, after constantly bringing up the lymph nodes and night sweats, and I finally got a great military doc to take me seriously. Turns out it was lymphoma. Brain tumor and cysts on my ovaries. Brain tumor. Got told it was PCOS. This was after I had brain surgery for a brain tumor and the pathology confirmed beyond a shadow of a doubt what kind of disease it was causing. It came back and the doctor told me it was just PCOS. No, I grew another tumor. A dear friend that passed had gone through breast cancer, double mastectomy, radiation, chemo, she beat it right. 2 or 3 years later she presents with severe stomach issues, in the over and over. 13 times it took them 13 freaking visits for them to order a PET scan. Cancer was back, everywhere in her stomach. Months later her bones. She was gone in a few months after that. SMH. Nothing major, just endometriosis. I had gone for years. By the time I could get an ultrasound, I wasn't in pain from my cycle. I can't count how many times I was asked if I wanted a psych consult. I fortunately had an early, easy, quick, uneventful menopause. Endo is major and can be horribly debilitating. We are conditioned to think it's nothing. You suffered for years and were ignored and gaslit by the medical system meant to help you. Women's issues are notoriously ignored. Gall bladder. Maybe we're so used to abdominal pain from periods that we discount it. If you have IBS, heartburn, sinus issues together, please ask your doctor if this is a possibility. Me too. Misdiagnosed for 6 months, pain getting progressively worse every week. Always seemed to happen in the middle of the night. I'd force myself to vomit because it was the only thing that brought me any relief. I'd spend the night rolling on the bathroom floor in pain for hours towards the end. Repeatedly told I had acid reflux, take Tums, suck it up. Tried every acid reflux med I could find. Changed my diet significantly. Pain still progressively worse repeatedly. Multiple visits, multiple doctor visits. All wrote me off as acid reflux. Never ever offered any tests or any other possible diagnoses. Every single one completely 100% confident. I'd never even heard of a gallbladder, had no idea it was a thing. Googling, intense stomach pain returns everything under the sun. After many middle-of-the-night visits, my partner at the time bitched at them and demanded they run some tests instead of just sending me home. I only went that night because I developed a new symptom, back pain. A doc had asked me if I had that. At the time the answer was no. I thought to myself, new symptom might new diagnosis. They finally did an ultrasound. Took all of 5 minutes. Immediately found major gallstones. I had developed pancreatitis, and I could have died. A few days later I was being scheduled for surgery and the doc told me, "Yeah, this is super normal procedure I do numerous times a day, tons of people have this." I wanted to scream. I kept twisting my ankle over and over again. I would be walking normally, and it would just twist out from underneath me. I'd go to doctor after doctor, and they would tell me my ankles were weak, that I needed to do yoga, and my personal favorite, I was overweight. Face with rolling eyes. Well, lo and behold, it turns out that none of that is the issue. I'm actually missing 3 different ligaments after the constant twisting, and I need surgery. Had one doctor done a simple MRI, and I wouldn't be in this mess right now. Pelvic inflammatory disease, PID. They kept telling me it was hormonal, my symptoms were normal, and I was being dramatic. By the time it was diagnosed, I was basically infertile. Ages 6 to 16. Doctors told my parents I was faking illness to get out of school. I finally learned to just deal with it. I was diagnosed with chronic anxiety at age 35. Finally having a diagnosis and medication has been life-changing. It is still terrible, but at least I know I'm not crazy. Trachea stenosis, 10+ years of wheezing and being short of breath. Always told to need to lose weight, or it's asthma. Went to a gyno to get IUD for crazy heavy periods and she mentioned my breathing sounded off. Sent me for a lung function test which came back normal. She sent me to a respiratory specialist who decided to do a bronchoscopy. Woke up in post-op with him sitting next to me saying my trachea was 60 to 70% closed just below my vocal cords. Too severe for him to fix, but he'd already spoken to the head of cardiovascular surgery who was his teacher who'd see me next week. Within 2 weeks was in hospital having a trachea dilation. Basically like a balloon induction but in your trachea. Managed to get it about 70% open. Just had my 3rd surgery a few weeks ago. Need surgery every 8 to 12 months for the rest of my life as it slowly starts to close again. Only permanent solution is to remove the part that's faulty and replace it. But that's a massive surgery and they only do it as a last resort. It's amazing how different you feel when you can actually breathe. And how quiet I am. I sounded like I smoked 10 packs a day before. Now I'm normal. That gyno saved my sanity and changed my life, with both the IUD and the chain reaction of finding this. Hashimoto's. I used to run an online support group for people with chronic illness. Most of our members were female, so many of them often had it take a long time to get a doctor to believe them that something was wrong, especially the young ones and the overweight ones. What blew me away was that just about every person that had Hashis had been blown off for years by their doctors. It took me 5 years to get a diagnosis. Symptoms started during my last school year and I was incapable of attending for many days because of the constant waves of nausea, heart racing, fatigue, brain fog and overall misery. Every time I went to the doctor they told me it was only in my head and that I was simply stressed out. I repeatedly asked them to look for something else because I knew that it was more than stress, but nothing was ever done. I finished school and started university and was still miserable. I actually developed anxiety because of the constant nausea and started to get panic attacks whenever I was in a room or situation that I couldn't escape quickly. It made my life so miserable that I actually left university, as I couldn't sit through the lectures in the packed auditorium, and moved to a different city. When I went to my new doctor for the first time, she took one look at me and my symptoms and ordered a blood test and an ultrasound of my thyroid immediately. And there it was, Hashimoto's. Since taking the proper medication, my symptoms have gotten a lot better. However, I haven't yet gotten rid of the anxiety and every time I feel the panic brewing up when I sit in an airplane, cinema, packed auditorium or other confined place, I curse that first incompetent doctor. I have Crohn's disease. It began manifesting with rapid weight loss and lots of bathroom trips along with some other symptoms when I was 15. My family doctor assumed I had an eating disorder and was abusing laxatives. My mom knew that wasn't true, thank God. She convinced the doctor and we got a referral for GI.